Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and our topic this month is You're Having a Baby, information for those planning a pregnancy or already expecting. Prenatal care is a very important part of a healthy pregnancy, and here to tell us more about it is Dr. Tawnya Kreilkamp. She is a board-certified family physician at Fairmont Medical Center who also practices obstetrics. Thanks for joining us today on Speaking of Health.
Thanks for having me.
Well, before we get into today's topic, let's hear a little bit more about you, Dr. Kreilkamp. You are from this area, right?
I am. I grew up on a farm near Elmore, Minnesota, not too far from here, about a half an hour, and I have lots of family around. From there, I went on to UW-La Crosse for my undergraduate studies and then went to medical school in the Caribbean. So I've been all over in the last few years.
And you've been all over, but why did you decide to come back to this area and to Fairmont Medical Center?
Partly because we love the size of the town here, and my husband and I were both looking for a smaller community. And of course, the big point was that my parents and two brothers are still in the area.
What is it about family medicine that drove you to be a primary care physician, and also obstetrics too?
Well, for the family medicine bit of it, I was having troubles deciding before residency what exactly I wanted to focus on. I had thought about doing internal medicine, psychiatry, obstetrics, and it was getting close to the decision point, and I just decided to choose family medicine after doing a student rotation in it because I didn't have to choose anymore, because I could do everything within family medicine. And then as far as obstetrics go, I think that's one of the more rewarding parts of my practice. You get to follow a woman from nearly conception or the early points of pregnancy all the way through to the end. You get to know the family, you get to follow the kids when they're born. So it's a great thing to do, very rewarding.
Well, today we are talking about proper prenatal care and taking the steps for a healthy pregnancy. First off, as soon as a woman thinks that she might be pregnant, what should she do?
Well, the first thing she should do is, even before getting pregnant, is making sure that she's healthy. She wants to be on prenatal vitamins as soon as she's thinking about becoming pregnant. She wants to make sure she's getting enough calcium and folate, especially in her diet. And from there, with a positive pregnancy test, you're going to want to set up the appointment with your provider so that you can get your first visit taken care of within the first 2 months of pregnancy.
So the prenatal vitamins, why are they so important?
A baby requires a lot of different elements and vitamins to grow the proper way, especially calcium for bone growth, and folic acid has been found to be great in preventing spinal defects, and in certain women it's crucial for them to take it if they have a family history of these things.
So even before they get pregnant, they should be taking these to build up those vitamins in their system?
Yes.
Mom has found out now that she's pregnant and she's coming to her first visit. What should she expect at that first visit? That
first visit is very lengthy. We like to get a thorough history from a patient, finding out about all their past medical problems, surgeries, finding out what medications they might be taking. We do a full physical exam, head to toe, might include a pap smear if there hasn't been one recently, and then we check blood work to make sure that everything is in order to be able to carry a healthy pregnancy.
Can you establish a due date on that first visit?
Typically we can. If a woman knows when the first day of her last period was, we can get a good guess of when the due date is. And if not, we have that patient undergo a ultrasound so we can get an accurate assessment of it.
So how often then after that first visit should a pregnant woman then come to see you during the first trimester?
During the first trimester, we like to have a woman come in every month, and the following visits after that first visit are much shorter typically. During those visits, we check height and weight and blood pressure, of course. Probably check a urine, may or may not check a urine for protein and sugar. And towards the end of the first trimester, we're able to hear the heartbeat. That's a highlight for most people. By about 11 or 12 weeks, we can hear the heartbeat with a Doppler by that time.
And what is Doppler?
Doppler is a small handheld ultrasound machine that picks up the flow of the blood within a vessel.
And I would imagine that's a pretty exciting moment for parents, right?
Yep, very exciting, sometimes nerve-wracking, sometimes it takes a little while to hear it the first time, but probably one of the highlighted parts of the pregnancy.
Well then, what should women expect for themselves physically during the first trimester?
The first trimester can be kind of rough. Sometimes there's nausea, vomiting, breast tenderness, sometimes a little cramping within the uterus as if you're having a period. And not until about the beginning of the second trimester does some of that dissipate.
In morning sickness, you hear about that so often. Does that normally occur primarily just in the first trimester then?
Mostly in the first trimester. By about 14 weeks, that should be nearly gone or completely gone. So for some people, morning sickness is lots of vomiting. For others, it's just a sensation of being nauseous and generally unwell.
And is all of those changes, is it because your body is changing? Is that why all of these things are happening to the women?
Your body is changing, that's correct, but also the hormones in your body are much different than they usually are, so it has effects all throughout the body.
So moving on to the second trimester then, does the prenatal care change at all?
Not a whole lot. There's still monthly visits, and at each visit we still check the height, weight, and blood pressure. We also will continue to check urine on occasional visits. We also will start to be measuring the growth of the baby by literally measuring the length of the abdomen to make sure it's correlating with how far you are along in pregnancy. And by 20 weeks, we're able to get an ultrasound, which checks to make sure that all the important parts of the baby are present and working correctly. And most importantly for most patients is we get to find out the sex at that time.
Do you find that, is it half and half with parents that want to know the sex of the baby or not, or is it more want to know?
I find most want to know.
Yeah.
Probably 95% of people want to know.
Probably helps with planning, I would
It does,
imagine.
and that's what everyone's explanation is. They want to
Yep.
be able to plan
Yep.
and buy clothes and things.
Yeah,
So.
you don't want to have a pink bedroom if it's going to be a boy.
No, not really.
So physically then, what's happening to mom and baby during the second trimester?
During the second trimester, baby is continuing to grow. The baby is becoming more active and larger, so the mom typically by about 20 weeks, if it's your first pregnancy, can feel the baby moving. A little bit earlier if it's the second or further pregnancies. Mom is usually feeling pretty well in the second trimester. Your energy is up higher, that morning sickness has gone away. Something you do feel that can be slightly annoying for women is some tenderness in the lower abdomen, which is due to the uterus getting bigger, but overall feeling better.
Braxton Hicks contractions, do those happen during the second trimester?
They can. It's a little, usually towards the end of the second trimester is when you start to feel those, and that's your uterus practicing. It's usually a little tightening here, a little tightening there, but nothing that lasts or is too strong.
Baby's not coming then?
Baby's not coming then, no.
Also, mom will get dizzy sometimes?
She can, especially if mom is laying on her back flat too much, because that big vein that goes back up to your heart gets cut off. And when that happens, your heart takes the effects and you begin to feel dizzy and not so well.
So moving on to the third trimester, as the due date approaches, we're getting to the home stretch. What's in store during those doctor visits right up until delivery?
The doctor visits become more frequent, still fairly brief, but more frequent towards that last month especially. The last month of pregnancy is weekly visits. We do a few more tests, such as checking for Group B strep, which is important to know prior to labor so we can start antibiotics if needed.
And what is that?
Group B strep, or Group B streptococcus, is a microorganism that can cause problems with the baby if the baby picks it up passing through the birth canal. It's not a problem for women because they handle it well, but baby can get pneumonia and other ill effects from it.
And what else is going on in that last month?
During that last month, mom is starting to feel uncomfortable. She will often have backaches. The belly is, of course, becoming bigger. Breasts are becoming larger as well as you get ready to produce milk. So trouble sleeping come with that too. Kind of going back to the first trimester, feeling unwell again.
And are you also checking the baby's position?
Yep, especially towards the last month of pregnancy. We want to make sure that baby is head down. If the baby is breech or head up, then we have problems with delivery. Not too many physicians anymore will attempt to deliver a breech baby vaginally.
So then what are the options for mom if baby is breeched?
If baby is breech, we think about trying to turn it ourselves, and we do that as family medicine doctors. We do that with the assistance of an obstetrician. If that's not possible or not thought to be effective or too dangerous, then a C-section would be the next option.
And I would imagine moms have lots of questions coming up in that last month, especially if they're new moms.
Right. We discuss a lot of things, what to expect in labor, what sort of pain management will be done during labor, and that's usually up to the patient. We discuss what to expect shortly after birth, and a lot of details get discussed.
False labor is probably one of those, water breaking, those kind of questions.
Yep, what to do if my water breaks, what to do if I have contractions, and generally what I tell people is if your water breaks, go into the hospital, no questions asked. If you have contractions, wait till they're close together, about 5 minutes apart, or so strong you can't talk or speak through them. and then head on in.
Physically, mom's going through a lot, that especially that last month. She's carrying an extra person around, right?
Right, and it can take the toll. You're much more fatigued and are more likely to have aches and pains.
Back aches, swelling of the ankles, those kind of things.
Right.
All right, so due date comes and goes now, and baby still hasn't come yet. Should parents be concerned at all that that baby hasn't come before or right at the due date?
No, they shouldn't, especially if it's your first baby. A lot of times, first-time mothers will go past their due date. We try to have that baby delivered by about 41 weeks, just because some studies have shown the placenta may not be as effective at that point, past the 41 weeks. But otherwise, they could come early, they could come late. It's hard to predict, almost never on the due date.
And so what are the options if you do come to that point and the baby hasn't come yet?
What we'd like to do is do something to get the labor moving, and depending on what the cervix is already doing determines how we're going to do that. Sometimes we use cervical ripening agents, which soften up the cervix and get it more favorable. And then to get contractions going, we'll put medicine through an IV called Pitocin. And typically we don't want to do the induction part of it before 39 weeks gestation, because babies have been shown in general to not do as well if we do it any earlier than that.
Are there any natural ways to induce labor? I know some people say certain spicy foods, or sitting a certain way, or
yeah, there's not a lot of good science behind anything that's truly effective. There are a lot of theories. Some people say cold things, some people say spicy things. There is some evidence behind breast stimulation, so that sometimes works. But otherwise, there's not a whole lot of good things to rely on.
Yeah, there's not a whole lot of facts with those. It's
Correct.
more it worked for mom or grandma or whatever.
Right. Yep. And sometimes your provider may strip your membranes too, which involves just separating your sac of water away from the edge of the uterus, and that can stimulate labor. Okay, well, very good. Unfortunately, we're all out of time, but we want to thank Dr. Kreilkamp for joining us today on Speaking of Health. Great topic. Thank you. And the phone number to schedule an appointment with Dr. Kreilkamp at Fairmont Medical Center is 507-238-8516. That's all the time we have today. Have a great day and be healthy.